Thanks for having me. It's really amazing that even though we have all these limitations, we can be together all over the world and learn new things and be curious and expand our knowledge. So it's really a great honor for me to be participating to this new way of learning, the Dental Online Conference. And of course, we much rather be in Dubai right now because here in Italy, it's cold and raining. And in the past, let's see why it's not running. Hold on. Okay. Of course, if people like me are in places where it's ugly and winter and cold, we all dream about being in the usual venue for a conference. You know, you usually take the chance of making a little mini vacation, going to meet colleagues. But then we had coronavirus, of course, and we really want to burn it because we're bored and tired with it. Then what happens? I'm Dr. Ruth Carpini, as dear Bassem said, and I met him in Dubai, but I live in Milano. And it's the city of fashion, of beauty, of everything beautiful. Italy is known for Italian style, for designer clothes. And of course, we care about a healthy lifestyle and of appearing always at the top of our game. So let's get started and find out what it is that ignites my passion. When we talk about facial rejuvenation, we want to start from the basics. We're doctors, we have a definition, so we talk about cosmetic treatments which have a goal to restore a youthful appearance. We all agree that kids are beautiful all over the world. Why are they beautiful? We want to keep those looks and maintain our appearance for much longer in life, because even recently, this has become much more an awareness of people to be able to stop aging and to maintain their appearance for a much longer time. And of course, the face is the place where we first see the signs of aging. But at the same time, we know that this is something that's not so new. It's been talked about and dealt with ever since the early 1900s. And if we see this article from Dr. Buck, Dr. Alam, and Dr. Kim in the Journal of Plastic Reconstructive and Aesthetic Surgery, we see that prevention is fundamental in maintaining a youthful appearance. And of course, we have to be careful about leading a healthy lifestyle because this ultimately leads and facilitates facial rejuvenation. And all the procedures are concentrated on skin tightening, and they concentrate on using different devices to obtain resurfacing, regeneration. This is a word that will be using along a lot of times and in a lot of different ways during this presentation. So where do we base our thoughts? What do? We usually want to inject considering the facial golden proportions, because we definitely need to take into account balance and harmony when we create a new face or when we try to restore what was lost. Dr. Pablo Ekari, we heard them talking about orthodontics. We're dentists. So what do? We all the time consider the golden proportions in teeth, in the profile. When we do orthodontics, we try to recorrect the symmetry that went wrong if we had a malocclusion. So all these things are extremely connected, and we can see how they apply to the face. So we always start from facial aesthetics, from proportions, and in particular, I like to use PRP as a dermal filler, and I'll show you how, because many of us have definitely heard about PRP, platelet-rich plasma, to perform surgery. We have it, have met this word, and we've been introduced to PRP because we knew it enhanced surgery. So it's in the dental office, and I had the pleasure of meeting Dr. Garg, who wrote this book, Autologous Blood Concentrates, explaining really well what is PRP. He is the inventor with Dr. Marks of this technology, and they started with surgery. They started wanting the fibrin, but since then they have discovered it pretty much 25 years ago. It's developed incredibly, and it has been applied to different fields because bottom line, what it does, it creates restoration, it facilitates healing, and it improves the capability of the body to regenerate, repair, and heal itself. So what can we do if we want to approach facial aesthetics? We have to develop an intimate understanding of the facial anatomy and of the processes of physiology. This way, we can really provide value to our patients, and we can be doctors, not just people who start doing something without the background. So the background for facial aesthetics, like anything we do in dentistry, is definitely anatomy and the understanding of physiology. We will see how everything comes together as we do this. Of course, we mentioned healthy lifestyle. So what has a lot to do negatively and has an impact on our appearance is a negative lifestyle. So smoking, exposure to smog in the very industrial cities like Milano, rapid weight loss. We think that weight loss is good for your health, and it definitely is. Going on in age, we're protected with cardiovascular disease, we have a longer expectation of life, but at the same time, when we lose weight, the face is one of the first signs of having lost a lot of weight, because everything starts coming down. And so instead of being happy about being lighter and being healthier, people start developing also psychological distress, because they don't see themselves as beautiful as before. Actually, they look a lot older very quickly. So we know that when we look at a young face, there's certain proportions that make up for a triangle which has its base toward the chin. And as we get older, the bottom part of the face, the inferior third, becomes more square. And so this triangle is inverted. And this is due to bone atrophy. We know that we have a resorption of bone, and it's due to the atrophy of the fat pads of the face, which we normally would have high and lifted up in these areas and also here. So it's not only a question of atrophy of the fat pads, it's truly also a question of dimensions in width that we lose over time. And studies have shown that over a period of 60 years, we can lose up to a centimeter in width in our face. And this is why the word filler is, because we need to fill and make up somehow for this loss of volume in different levels. And so PRP is fantastic because it stimulates bone growth. Here's where all the links are connected. It stimulates bone growth. So if we start early enough in age and deposit it on the periosteum, we can retard, we can stop and reduce this aging process. So it's definitely very, very good for prevention purposes. So as I was saying before, we have several fat pads. It's not just a piece of a portion of our face where the fat is deposited. We have separate compartments that are separated by ligaments and tendons in the face and help us animate. And this is why if we don't inject and don't know these areas, we might end up injecting in a place that's not meant to move or moves too much. And so it will look strange and not not balanced. That's why anatomy is so important. Normally, one of the first things that people notice and they come to attention for is the nasolabial folds. They're a natural part of the anatomy, but because we animate so much in our face, then we end up seeing the drooping of the fat pads in the upper area. But as I was saying, this starts from the forehead and then all the upper areas, and eventually will come colliding down. I'm a little older, so you can see that I have them. And of course, I've tried to mimic, because I tried to use all these things on myself first as I got older. When you're young, you're not interested in facial aesthetics. When you start having a couple of years on your back, then you definitely start trying to find out things and natural ways to help yourself. So as I was saying before, we see the evolution from young to medium age to older age. And the reason of the wrinkles, it's really laying on this resorption of the skull. We can see here, there's a different size in the skull and a different size in the fat pads. It really, really reduces over the years, and it ends up not being desirable. I'm trying to see if I can put this up. I don't know if you see all the screen. Let me know if there's anything that gets missing, and I'll try to compensate that. And now it's not changing anymore, pardon me. Okay, so this is just we do science as well, we're doctors. So this is a slide from Dr. Snezana Pauls. She's a great surgeon. She likes partial extraction therapy. All the references that I like to use for my conferences or to validate my path in the medical field are scientific. I like to read articles to understand the biology of what I do. And it's very, very important, because once you know the biology, then you can really move forward and give your patient something that's in their interest, understanding how everything works, kind of like an engineer, and then trying to fix it and putting it back together. So in recent year, one of the main goal has been to try and use procedures that were not surgical. We used to look with not so much appreciation toward real plastic surgery, because that looked invasive. And so everyone has been interested in trying to find out if there could be easier ways to improve our appearance without having to go under the knife. And so the possibility of derma fillers are many. We know hyaluronic acid, that, as the word says, we need to fill the volume that has been lost. I said it before. So we have hyaluronic acid, calcium hydroxylapatite, polylactic acid, polymethyl methacrylate, microsphere, so semisphere, cement type of things, which are really not so much desirable. Autologous fat is very desirable, but is not our field of expertise. We are dentists. We are not allowed to go and harvest this fat in other places. We can use the Bichat fat in the mouth, but other than that, it's really out of our reach. And also, these are very invasive procedures. So we would like to find something that's a little easier to find and use. And my presentation got stuck again. When we think of the different types of derma filler, we have to consider also the risks involved. So is it really easy? Is it really desirable? Is it really in my patient's or myself best interest? And even though we like derma fillers with hyaluronic acids and all the other different kinds that I mentioned, we have to consider that they can create side effects. And these side effects then need to be managed. They can cause rashes, itching, flare-ups of autoimmune diseases, swelling. And this is all part of natural reactions to a foreign body. But mainly when we have a foreign type of filler, we can have asymmetry, we can have lumps, and we can also have an overcorrection that then requires some type of antidote. We have to use Hyalase to get rid of the hyaluronic acid that maybe we misplaced. And when we have more permanent fillers, like we saw before, the cement type kind of fillers, radius, then it's much harder to reverse these procedures, and we can have some undesirable results. But truly, the main risk with hyaluronic acid when the dentist and when any type of newbie approaches this procedures is the risk of vascular occlusion, which can lead to necrosis. And necrosis is really bad aesthetically because we were trying to get an improvement, and also we can have blindness. So you see how non-desirable this is, because we were trying to improve the situation, we were trying to regain freshness, youth, beauty, and instead we end up with a very bad scar if we have necrosis, or blindness. The risk is a little too high, in my opinion. So this needs to be taken into consideration when understanding what would we like to use as an instrument of beautification. This is why I insist a lot on the knowledge of facial anatomy, because if we think that we're so good to inject in between these little arteries, all the veins, the face is a very intricate network of arteries and veins, and see how we can do the nasolabial folds or the lips or the lower area and think we're very far from the eye, but instead the risk is real. And then knowledge is power. So if we know the anatomy, this is why I always start in my courses with anatomy, because this was not taught to dentists in this much detail, and how to find the landscapes, how to avoid the dangerous areas. As long as we know what we're doing, we're safe. And keeping this picture in mind and keeping in mind the real risks that can happen, I think sets us up for success. So we know where we need, whenever we don't know anything, then we can't improve. When we know what's the problem, where's the critical parts, then we can work on those and move on. So how do we go from PRP in surgery to derma filler? How a lot of people have seen the liquid form and think that's what I'm talking about. I'll show you in a minute that that is not what I'm talking about. I'm talking about a real filler with a solid form. And this group of doctors led by Dr. Orentreich and Dr. Krajik Roslia presented a patent in Canada. I think it was in 2001, and this patent showed different ways. We're a little bit of engineers as doctors in general. We have science around us, so we like to play with things. And so they tried to perform different procedures on PRP and to see what happened with it. What was the longevity of it? They thought, can I make it solid? Can it last longer? And so they understood that, of course, PRP was more desirable than all the other derma fillers, than even the autologous fat. Number one, because it was a patient's own material. So it makes sense in the very beginning that it would be something extremely desirable, the body that heals the body. And then it was easier to harvest compared to the fat from other areas of the body, and is less traumatic. So it's definitely a desirable situation. And also they found out that the protease enzymes don't destroy our PRP dermal filler just like they would with other dermal fillers. So the longevity is much longer naturally, because even though I inject it, and so technically it would be foreign to that area in that moment, of course, being the same DNA and the same characteristics of our body, the body has less degrading processes toward the PRP. So sorry, let's see. So this is what I don't know why it's not moving. This is the article, and if you would like to read it, I can try and share this. And we get into the real heat of the presentation now, talking about plasma protein filler. That's how we like to call it. So it's PPF, and it's denatured by heat and then combined with the liquid form to make a filler that has all the interesting characteristics that we talked about before. If you remember, I said that PRP can be injected on the bone and stimulate and avoid the bone resorption, can stimulate all the tissues from a deep level and do a real regeneration, not just a filling. When we use hyaluronic acid, it will only take the room and the space of the atrophied fat pads, but when we inject PRP in the sense of a filler and we mix it with the active part, we're doing two things at the same time, and we're doing real regeneration. So the advantages are, of course, the color, the consistency, because autologous fat tends to give a whiter appearance, too white. Under the lips, for instance, we like a nice red color, and this whitish hue that it comes with it, it's really non-desirable, or yellowish, because that's what fat is made of. The good and desirable characteristic is, of course, we have no risk of allergic reaction, is 100% safe. People always ask me, but are you sure? And I say, well, think about it. Your blood runs in your body all day, all your life, and there's nothing, no one is allergic to their own blood. So it's definitely impossible to have problems in this sense. And of course, we have a lot of many advantages. We can increase, improve the aspect of lines. And why does PRP work? What's exactly inside it? It's a concentrated of platelets, and the platelets contain within themselves the growth factors that are so desirable, both for surgery because they improve the bone management. Excuse me a minute. Sorry. Oh my God. Sorry, my throat got dry. So the platelets are enucleated cells. They have a lifespan of about 10 days. But what we like about them is that they are metabolically active. That means that they not only exist, but they do something. And so they secrete growth factors and release them in response to coagulation. I'm sorry, I need to drink a little. Oh, sorry. I'm dying online, sorry. So not only they release this granule, they store them, and they make them available after the coagulation cascade is activated. So there's a lot of articles also written by Dr. Gard, who researched this extensively and produced a lot of articles and literature. So if you like to read something in detail about platelets and their functions in PRP, I definitely recommend these articles. So what we know and what we like is that originally we have stem cells. Stem cells are so much talked about. There's controversy, and I'll explain the controversy in a minute. And from the stem cells, we have a whole cascade of events which help the cell differentiate into what we might want. And eventually they become platelets. So this is what happens in the normal evolution of the stem cells. The stem cells have the ability of being differentiated in the tissue where we apply them. And the controversy is only because the stem cells lose this ability to differentiate at the speed of light as we grow older. And so the very powerful ones are found in children, in babies, and even before birth. So the controversy would be to harvest these cells not from yourself but from someone else, and then apply them in medicine, because that would make, you know, all the bad things happen if it's not properly regulated. And right now the technology is still not there to use foreign stem cells in the sense of getting them from before birth. So we use our own. We can concentrate them with the process of the centrifuge with PRP, and we can apply them to all of our uses. So it's our own stem cells. They're very few, about 2%, but they're so powerful that they really, really make a difference, both in healing and in regeneration, and in activating all the processes that create collagen, fibroblasts, and everything nice that we like. These are the platelets in all their different forms in the bloodstream. And what they do is they release these active proteins and induce morphogenesis. That's what we want. Genesis means birth. Morpho, form, we want to create, rejuvenate, and improve everything that goes on into the body, the blood flow. This is why it gets resorbed. This is what creates atrophy, is lack of oxygen, is lack of nutrients. And we know from school, from physiology, this is why I was mentioning that physiology was so important. Oxygen is carried into the blood vessels. As we get older, all these processes slow down, but with PRP, we can give them a kickstart, we can give them a good meal. And after a good meal, it's like a power drink for our body. The new blood vessels can be created, carry more oxygen, facilitate all the different processes that bring healing and restoration. So we see that all the different growth factors produce angiogenesis, mitogenesis, they create new cells, and macrophage activation, so they are anti-inflammatory. They create new blood vessels with the VEGF. This is my favorite growth factors, because creating new blood vessels, as I was saying before, we bring to the table much more oxygens and nutrients, and all the cellular processes are increased. And so we also have long-term healing, bone regeneration and remodeling, as I was saying, and then cellular differentiation and growth. So the platelets have all these different granules. We'll go very quickly. When we'll do a course, we might want to go on the details a little more, but we needed to have the basis to understand what we were doing. Albumin is the main protein. This is the one that we will transform in dermal filler. And from now on, we'll go to the fun part, because if you think albumin is like an egg, the same protein that it's in the egg white. So when it coagulates, how do we coagulate the egg white? By cooking it. So even though it's a little bit of an improper term, but we cook the PRP in the sense, and I'll show you in a minute what are we cooking exactly and why. If we want this good cells and we cook them, how can they then be active for regeneration? Because we don't cook the active part, but the poor part, and I'll show you in a minute. So what we need is centrifuge, and we need heater to obtain this form of the PRP. But the first thing we need to do is a venipuncture, because, you know, no blood, no party. We definitely need the blood. My preference is a cannula, and I'll show you in a minute why. It's less traumatic. You do one poke. So if you realize that you do not have enough blood for your patient, you can do a little more. And one thing I really like is the fact that it can create less hemolysis. Less hemolysis means that you're going to not ruin the cells. Those cells are so precious. We said that stem cells could be about 2%. They're so important that as they go through the needle, they part of the blood flow part of the cells gets cut, sliding through the needle of any type of poking needle, butterfly type of thing. And with the cannula, you only get one poke. You insert a circular tube, and this tube doesn't cut. So you just direct the flow of the blood from the blood vein to your vial, and then you can spin it. This video is very short, it's less than a minute, and it's one of my first videos where I was learning how to do a video, but the procedure is really, really quick. See, I'm trying to get my hands out of the way, figuring out how to do everything without having too many people, but it's really, really much faster than that. And once you get efficient at it, it does not even take 1 minute. And this is something they don't teach to dentists. I learned it by myself, and I am very proud of that because it's so much more comfortable for the patient. It's easier even for dentists who are not so experienced of getting blood all the time, because if you can see the vein, and I usually teach how to do it, you will get your blood every single time. With butterfly, sometimes you see the vein, but then you don't manage to get into the vein and get the blood out. It's a little more difficult. So we use yellow tubes with anticoagulants, and then we spin them in this centrifuge. And let's see why it's not going forward. There we go. So here is our blood into the vial. It goes very quickly. It takes a few seconds to fill up one vial. And of course, everyone wanted to see a little action. So I put also the little video. And then you can see how quickly we put it into the centrifuge, and we get it going. So it's very, very easy. In the meantime, we can prepare the skin for, let's say, a microneedling, and we can move on. So what we obtain is liquid gold, as I like to call it. But what's really important in the next procedures, the top part will be poor of anything interesting. It's a little more, it's a little better than a saline solution. It's our own, it's serum. And then the bottom part of this vial, in close proximity to the red part, is where all of the platelets are concentrated and where the liquid gold really is. So we take the top part out and we put into the heater that part there. So here's a little slide that shows the different parts that we find in the PRP vial after the centrifugation. We can prepare as we wait the face of the patient. Here we did it for a little bit of dramatization. It's not that red if you don't want to. We wanted to show the vampire facelift like they do in Beverly Hills. The Kardashians made it really popular, but this is what creates rejuvenation and induces collagen. It's also called collagen induction therapy. See, we grate the skin with a derma pen, which makes little pricks. And the nice thing with the liquid part of PRP is that as you make in this little hole in the skin, and then you apply the serum, the PRP liquid gold, after you're done with treatment, the patient goes home and it's perfectly healed. So it's not an entry point for infection. It's really, really safe. And this is what it looks like when you pass it through the heater. We have to use several different temperatures. We can go over in detail if we do a course. When we want sensitive area, we use a lighter temperature, so it is also more fluid in application. If we want real volume, then we try to leave them to leave the vials more dense and coagulated. So this is how simple the procedure is. As you're doing your facial, you see that we put the liquid pore part, it's the lighter color part, we put it into the heater, and then we just very quickly, that other syringe was a little, we took a little bit of the red part by mistake, but it's really, nothing happened. So no worries about doing anything. What it looks like after it's finished is, of course, this nice yellow creamy color. And the reason why I put this little video is to show that a desirable trait of the machine that does the heating is also to cool it down. Because if we raise the temperature to 75 degrees, of course, this is not injectable, and we don't want to scorch our patients or to kill the cells. And so we slow the temperature down to about 20 degrees, and then we mix it with the real concentrated part. So from each vial, I take the PRP, and then I mix it with this other more dense part, and this is what happens. It looks very solid. You can see this is a 10 cc syringe. It looks kind of scrambled eggs, but cooked, but at the same time, it has size and it has consistency. So what we need to apply it is bigger cannulas very easily. There's entry points that we can choose and allow us to get to every area. We can go far and reach the areas so that the poke is not visible. We can anesthetize the areas where we will put this big cannula, but it's really not that big and it doesn't show at all. That's the magic and the beauty of it, and that's why I get so excited about PRP. So you see that even after the liquid part is absorbed, you are left with a real volume, and I showed you before the pockets and the fat pads. And so you can see that it's definitely something that you can apply and create height and bulk and replace a dermal filler just at the same time. So this is the instrument that we use to mix the liquid part with the dense part, and we can go and obtain our goals of beauty. We want harmony. We don't want to create monsters. We want to keep in mind all the facial golden proportions that we mentioned before. And of course, this is what we find. And if you paid attention to what I said before, starting from the top of the face, we have atrophy and sagging. But the main reason is because the structure, the scaffold is smaller. See this scaffold? If it's smaller, all the things in them will fall down. And so this is what we see. And in this cadaver, it's very important to learn anatomy. We see how it's all very small, all very dried up compared. And these are the areas that I was talking before, where we need to add our filler. We pay attention to the ligaments, because ligaments hold, retain, they're called retaining ligaments, and they can retain our rebuilding. Here in the upper area, we can mimic, and when it's a big problem of sagging, if we start in the upper part, we divide the volume that we think is all down here, we start adding here, 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 here. By the time we get here, we don't create heaviness, but we create lift, because we just put back the things that we had at the place where it's supposed to be. So the treatments are 4 to 8 weeks apart. It's really good to also get blood for rejuvenation of the whole body. People are scared of getting blood taken, but every time you do a blood draw, then the body starts pumping and rebuilding on a complete level. So here are the results. We try to go fast. I try not to take too much of everyone's time. And here you can see immediately after, this is because I didn't want to put too much. We also did pedio threads on this patient. What's very important is understanding you can only fill so much. If you feel too much, then it's going to look strange and bulky. But then if you use a combination of PRP or any kind of filler and PDO threads, you can create lift and not heaviness and restore real harmony. So this is the lady on different angles, and you can see that we have a real improvement in the cheek, and this improvement was done with the PRP dermal filler, and this here is the entry point for her PDO threads that we put also in the face, in the neck, and you can appreciate the jawline. And the PDO threads improve over time. You have to be patient for these things because many people don't want anything to be seen, then it doesn't show enough. And then if you follow this desire to be very, very visible, you can go against harmony and against balance. Right now she's a little numb, so she smiles a little strange, but what we can see is a complete restoration, and we can expect the PRP to be in position for 4 to 8 months, 6 months. But as I said, it really depends on the lifestyle. If someone does a lot of sports, their metabolism is much faster, and so the necessity for a little touch up can be faster than usual. We can appreciate the difference around the eye, how we completely took care of the bags, and this is also something that needs to be addressed in the diagnosis to see if it's a treatment that could benefit the patient or not. This is a young model. She wanted to, she looks sad. She's a beautiful woman. She looks sad, older. She says, "Doctor, I have to deal with young models. They're 15. I'm in my 30s." And so she wanted to freshen up and look more beautiful. And even though she's beautiful, she's too thin, so she doesn't have any roundness into the beautiful areas that we normally would like. And so this is the after. You can see how her cheeks show definition, the 3D definition that makes beauty. 2D is non-desirable, we know that. And we can see the difference between the lips before and after. This is immediately injected. You can see a little point here. I even injected in the forehead, and it's a very dangerous area if you do it with dermal filler. Requires sophisticated training. What I like about PRP is that it's perfectly usable anywhere for us when we start, when we still don't have the confidence, the knowledge of what to do, but we can really start creating beautiful results even at the very beginning, because everything we do is completely safe, and that creates a lot of relaxation. You start seeing the beautiful results, you get more and more in love with the procedures, and you develop the skills, because everything needs to learn and needs a learning curve. These are the areas that we improved, and they're very visible, but at the same time, she doesn't look, if you don't look closely at the little marking on the forehead, she doesn't look like she had anything done. This is before and after. You can see the 3D definition. This you know normally can obtain with makeup, but she immediately looks prettier. The skin immediately starts activating, and it happens right before your eyes, and it of course improves over time, but you'll be shocked on how beautiful they look immediately right after treatment. And this is the same lips, just a little bit of Vaseline, how we corrected the hollow under the eyes. This patient is easy because you can see the veins and imagine the arteries. Other patients, you have to know a little better where they are. And this is even her words.
Morning. So it's the day after my treatment.
She's very
As you can see, most of the swelling is gone. I've got no makeup, just had a shower, feeling fresh.
Definitely PRP.
Actually very, very happy in my own skin.
Dermal filler can definitely substitute any type of fillers. You will see here a gentleman, again, he wants to do a little something for himself. And we went with cannula. This is part of a training. I show how to get into the right places and how to it's a artistic work. You have to see with your eyes. There's no perfect formula for everybody, and with your eyes you have to learn and get trained and what's acceptable, what not. Don't be scared of showing the patients. I usually give them a mirror so they can look with me what they think is acceptable for them, and that's very important because it creates a beautiful relationship with the patient. You can see how from being very flat on this area, we are creating volume, and I'm evaluating from all different angles what it looks like. And you can see before and after. It's an improvement, but not so visible for the untrained eye. So if someone doesn't know him, they don't really know that that he was lacking volume here the same day. These are beautiful results that I'm very proud of. And again, we're just creating definition, and see how after a few weeks it's getting better over time. And we did pedio threads for him too, because we fill, we lift. It's very, very important to get it at the same time. I think we already saw here maybe a little detail of the technique to that cannula is, if someone who's listening doesn't know what a cannula is a long sort of needle, but it has round tip, so it doesn't hurt anywhere. And you just have one entry point, no trauma. I'm not creating bruises under the skin. I'm just depositing my product where I want it. Where I want is exactly here in the pre-zygomatic space. So it's hidden. The muscles can still animate, and so the result looks very natural. We want to go into this space so the muscle, the mimic muscles, can still mimic and can just look a little further up, and we hide the ligaments and all the tendons that normally look and make our face so sunken in. So we see the before and after, we see the little curve. It's not a big, if you don't want it. I mean, if you want to create monkeys, then of course you fill it up even more, but it's a definite improvement, but very, very subtle. He can go to his office, come back, do a little more, and look younger over a few sessions. Patience is key. I looked a lot more drawn, and I kept it 3 seconds because it was too ugly of a picture. But see, I do the same treatments on me, but we'll be brave. And let me see if I can show you again. No, hold on. See how I lost so much volume? So I want to be brave. These are the ligaments, and see how everything is coming down. And here it looks like a peanut type of thing, but if you see now, it's more fuller. And I've done all of this with PRP or regular filler. I use either one or. So, you know, we just look, I don't want to look like someone else. I don't want to alter my facial traits. I just want to keep going and you know, enjoy my life, because in my head I feel very young and I feel very active. We have more videos. I try to go fast because otherwise we don't have any. I have a lot of material because I like it so much that I put a lot of different things. She doesn't look very happy, but because she was scared, and before and after. So we just look for balance and beauty. And of course, maybe the angles of the pictures. Milos maybe might complain about my pictures, and he's right. I have other skills, and the picture is not one of them. I try every day, but my pictures are really bad. And these are another angle, but what we're looking for is harmony and balance from the side. See how the contour is perfect. And this is what we're looking for, because we need to know the anatomy of everything we're saying. So we always go back. Basic, Dr. Ekare said the same thing, basics, always the same things, in the sense that if we know the anatomy, we can replicate and find what's really perfect for the patients. I have to go a little fast. See, also, this is a difficult area. We said at the beginning, we can create blindness with regular filler. With a PRP, a little more liquid, not so dense as I showed in the beginning, we can very easily there's no anesthetic here. There's only a little bit in the point where I enter with the needle. And you see that the lady is extremely comfortable. She's not jumping, she's not moving. The lips are natural, very soft, just like her lips. She has naturally voluptuous lips, and see how they look like a little bit of a symmetry here, and 2 minutes later, everything, it's the swelling that creates the little illusion of not being perfect right away. This is another patient. We did the hollow in the temples, as I was saying, and see why they call it plasma glow. This is no makeup. This is immediately, a couple of days after, maybe it was done as Friday and then Monday, not the same day, but look how immediately it brightens up the face, and it fills another super dangerous area. But with PRP, we go here so easy and relaxed, knowing that we do not have any problems. This lady had good volume in the other areas. We can't feel here. We have to help her here. So it's also very important to understand where the problem is, and the anatomy. Again, the anatomy, if we know where it is, there's certain ways of avoiding complications. This is a patient that's being injected exactly where I was saying. And as you see, she's comfortable, she's laughing. I'm just having them go at the same time so we can see. We just go slowly, we talk to the patient, they laugh, they're comfortable. No anesthetic, just the point of entry, and they feel nothing. When they feel something, we go a little slower. So this is the before and after. I want to spend a few minutes on period threads, because there's so much to say. I was trying to concentrate and cram, but at least the definition. What is period threads when people think so, but what are they? We use sutures. We just use everything that we find in the dental office all the time. The blood we use for surgery, the sutures we use to close the wounds. And so we are familiar with resorbable sutures. And if you think about it, they're blue. So period thread, in the sense for cosmetic, is the same exact thing, but it's a special medical grade suture, and it's a synthetic biodegradable polymer. So this is the key, that it's biodegradable. It creates a foreign body reaction, and then it improves the blood flow to the area, stimulating neocollagenesis. So they produce elastin, hyaluronic acid, relaxes tendons and muscles, but it can help us not need big volume when we're trying to do our treatments. So here's a little bit of action with the PDO threads. I'm talking, explaining, so it can go a little faster. I'm looking at the watch. I hope I'm not stealing other people's times, but you can see how very easily we can go under the neck, tighten the neck, and then it goes pretty fast. Here we can put them, they're smaller. So the size is what creates the lift or the collagen induction. If it's small, it can create collagen induction also when it's big, but the main purpose of when it's big is to create lift. And then it reabsorbs over time. You can tell your patient that it takes 6 to 8 months, depends on the people's metabolism, even longer, but the results can last up to 2 years. These are the results. Not a happy patient. She learned to smile after. This is, again, the results. Also to do the contour of the mouth to learn. Not everyone is born a beautiful artist in creating the lips, but the little PDO threads can help make the shape of the mouth. Yes, and then this is also the case. I don't know why, that was another video, but for some reason it's not playing. And no, it wasn't playing, sorry. So anyway, if we manage to ignite your passion and make you interested in a little bit of facial aesthetics to add to your practice, maybe next time we can be in Dubai or somewhere really fun to be and have also a wonderful time together. But in the meantime, I thank you. And I invite you to our online course that we're doing on November 3rd, right, Bassem? If you mentioned that, and the information are on dental online conferences. So I'm going to leave with this picture, and you can go ahead. I hope I didn't take too much time, sorry. Thank you, Bassem. Thanks everybody attending and for your patience at this time of day.
Thank you very much, Dr. Ross. And we are very exciting about the information. You can hear? Okay.
Yes.
Yes. So we'll see you also in 3rd of November for the in advance course about PRP, and for sure we looking for the information that you can uh, possible to do in this course. There is some questions about what is the preference filler that you use if it's close to the eye of the patient?
Definitely PRP for a dentist. I want to say something that's very important. In not every country, dentists are allowed for certain procedures. Okay, so in general, I followed a lot of plastic surgeons, and I like that even they prefer PRP. A lot of very good plastic surgeons or dermatologists who do filler, they like PRP under here because it's a dangerous area. It's difficult to treat sometimes, and so sometimes it can have unpleasant aspect because of the Tyndall effect. You have to select the right hyaluronic acid, the right type of skin. So it's an advanced procedure, but you can get a big improvement, and maybe I'll show it in the course because I've done it from the very beginning. You can get a very big improvement just by using PRP, either liquid or a little more solid, and it becomes beautiful. It's very easy and not dangerous at all. But it also depends on the patient, what type of result they want, and where I am in the world where I can perform these or not. But PRP is definitely my preference.
Another question about if there is any 3D software to give the patients the predictable.
The beginning of the question.
If there is any software that can give the patient how he or she will looks after the treatment, if there is.
There is. I saw some, but you need to have a body scan type of machine, and some 3D scans have that. Milos was presenting the 3D scanner, and I don't know if only Medit has that one. I don't know the names. I'm sorry, I'm not aware about that. I still do those things handmade and old-fashioned, but there's software, and if you're willing to invest in that for the glamour of having something really professional, it's beautiful. I've seen it in action and it looks really nice. So that's something that you can do, just like we like to simulate when we do treatments and show them the before and after with the liners, with the other pictures that we have. It's the same concept, but you need a facial scanner for that. Yeah.
Thank you very much for this information you shared.
Do you have that, Sam? Do you have that 3D scanner for the face?
Yes.
Do you carry that?
Yes, we can.
Oh, that's good. That's wonderful. So you can show your products, and I want to try that. That's beautiful.
Okay, thank you very much. And if